Okay, I am sure many of you here have seen on social media accounts like this saying that hormonal birth control in the US is a group 1 carcinogen. And many of you have asked me if this is true. The answer is yes, it is true, but let me explain. Now, there are two main organizations that determine whether something causes cancer or is a carcinogen. And those two agencies are the International Agency for Research on Cancer, the IARC, or the US National Toxicology Program, or the NTP. The IARC is also part of the World Health Organization. When something is determined to be a group 1 carcinogen by the IARC, that is because there is sufficient evidence of carcinogenicity in humans. Now, for the IARC, when it lists something as being a carcinogen, it simply means that there is a level of evidence that something can cause cancer, not how likely it is to cause cancer. For example, they have both processed meats and smoking as being a group 1 carcinogens on the list as well, but that doesn't tell you how likely they are to cause cancer, but we know that smoking is probably a lot more likely to cause cancer than eating processed meats. Another important thing to know is that even if a substance or exposure on this list is known or suspected to cause cancer, this does not necessarily mean that it can or should be avoided at all costs. And finally, these lists contain some commonly used medications, like hormonal birth control. Now, if you go to the IARC and you look for the monograph specifically on combined estrogen, progesterone, contraceptives, and also combined estrogen, progesterone, menopausal therapy, this is what will come up. And you can actually download the entire monograph to find all the evidence that they have. And since we're talking specifically about hormonal birth control, we're going to talk about combined estrogen, progestogen, contraceptives. Now, if you go to this monograph and you scroll down to their overall evaluation, they say that combined oral hormonal contraceptives are carcinogenic to humans, group 1, but they're talking about the increased risk associated with breast cancer for those who are taking combined hormonal contraceptives. Combined oral hormonal contraceptives. But they also go on to say that there is also convincing evidence in humans that these agents confer a protective effect against cancer of the endometrium and ovary, meaning that taking these same contraceptive pills are also protective against having cancer of the endometrium and ovary. Dr. Jess left that part out, didn't she? Now, ACOG put out this practice advisory, hormonal contraception and the risk of breast cancer. And here are their key points. Pause to read. Now, what accounts like Dr. Jess do is they put out these salacious posts to scare people to death without offering any context, clarification, or education like I just did. But they will make sure that they send their 300,000+ followers to their link in bio with a code so that they can make a little pocket change.